We'll start, though, Jim, with this story that we do expect to get more detail on later on today, and that Merck is going to help J&J make the vaccine. Washington Post helped break the story this morning, says the White House helped broker this arrangement, and that if it is at peak production, it could double what J&J was going to do on its own.
All right, I'm glad to hear that, because I had felt that J&J's combined amount that they're going to put out with Emergent Bio, which is one of the biggest stock gainers yesterday, was far bigger than what they announced. And I know some people were saying, Jim, you thought they were going to do $1 billion, and I still do. But this is really terrific, because what we're getting, Merck helping out, I wouldn't be surprised if more don't help out, is a recognition that we're going to beat this thing. And we're going to beat it much faster because of how the scientists and the drug companies have been willing to work together in a remarkable way. And don't forget, there's Sputnik, which is doing quite well. Russia, that's selling it over many different places. AstraZeneca is being used. So the J&J, David, if others would join, can you imagine? They'll get to $1 billion.
Yeah, listen, I mean, we're going to get to 400 million doses available, which is obviously more than the population. Even double counting as you need to with Pfizer and Moderna. J&J obviously one dose. By the summer, I think, and having discussed it with Meg Terrell, who we go to for all things vaccine-related, Jim. So then the question becomes the rest of the world, which you also need to vaccinate. Could take some time, but perhaps that gets there more quickly, enabling a lot more travel, for example, and things of that nature.
Well, look, it's very important to remember that the J&J vaccine is like flu vaccine. It can go anywhere. And, David, if you don't need refrigeration, well, let's just send it everywhere. And I think that we're going to find ourselves traveling. I think, Carl, one of these things that's going to happen is you're going to carry your card. I don't know what kind of card they're going to give you, but I feel very strongly that you're going to have a pass. And that pass is going to say you can come in. And it will be very important, because I think that when you go to a restaurant right now, they take your temperature, which we know exactly has very little correlation with the disease. A pass is much better, and I think it'll change life dramatically.
Shepard Smith here. Thanks for watching CNBC on YouTube.